The beauty scientists, Dr. Kristy Hamilton and Dr. Kim. Real beauty without the hype.
Kristy, what's your definition of like regenerative medicine, regenerative fillers, things like that?
So this is a very exciting new area of medicine because we are talking about regrowing your own tissue. So stimulating your own body to produce what's been lost. So we know that after age 25, for example, if we're looking at collagen, we start breaking down more collagen than we're producing. And so we go into this like slow deficit and usually doesn't show up until closer to 10 years afterwards. So that's why we have a lot of people in their 30s coming in noticing that their faces are starting to change. And then even more so for women after hitting menopause, as you taught me. But this is it. It's a different approach. Instead of directly replacing hyaluronic acid with a filler or doing fat transfer to replace the fat pads, we are injecting something or applying topicals to stimulate your body to produce what is missing or has been slowing down in terms of your body's production.
So the question is, can regenerative treatments, in your opinion, actually make tissue, skin, our appearance actually more youthful and regenerated?
That's what we're starting to see. So this is all early days, and you and I were always very careful to speak in like absolutes when we know we've got great data behind it. This is definitely, it's early days in the field, but I've been very impressed with the use of regenerative medicine myself in my practice. I've seen changes in my own skin, in my patient's skin. And if we look at the fundamentals of what these, and there's different kinds that we're going to talk about, but what they do, it makes sense that it would help to renew, rejuvenate. And it's a step towards anti-aging medicine. And that's a topic for another day. But that's what we're trying to do. We're trying to get our cells to function more efficiently. And we're trying to get them to work as well as they used to when they were the cells of a baby or the cells of a very young person.
Yeah, this is very exciting technology and news because it's truly regenerating. So there are a couple categories, including your own tissue, not your own tissue, but still biologic. Finally, not your own tissue and non-biologic. First off, your own tissue. What do you think about stem cells and regenerative medicine?
So stem cells were considered the ultimate for a very long time, but they're also very controversial and there's a lot of laws surrounding them. So there were products being developed to try to stimulate growth of like healthy new skin. I mean, it would be great in surgery, right? Where we're dealing with scar tissue or wound healing, but they're bogged down in legal issues associated with like women's health issues. And so that stem cells, I don't think are going to be the future, at least in the United States, maybe in other countries. But stem cells they're used to promote the regeneration of cells, repair damaged cells, reduce the signs of aging, and you can derive them from your own body. So we do employ these principles when we're doing like fat grafting, for example. So we know that the highest concentrations of stem cells in fat come from the inner thighs and the lower abdomen. So that's where I commonly like to take fat to transfer to the face, for example. And patients will notice not only an improvement in the volume loss, but also oftentimes will note that their skin also looks nicer. And that we're assigning to an effect caused by the transfer of the fat, specifically with the stem cells.
Yeah. And so for the consumers out there, stem cells are what I like to call great-great-grandfather cells. If you give them the right environment, the right recipe, the right chemicals, a stem cell can turn into a skin cell, muscle cell, cartilage cell, whatever. That's why it's so powerful and cool. But as Dr. Hamilton has noticed, it's not quite the wonderful benefit that we thought of. And as plastic surgeons, we actually have awesome access to it because a high concentration of stem cells are found in our own fat.
Thank you for joining us on The Beauty Scientists. Be sure to visit thebeautyscientists.com and learn more about modern beauty and connect with Dr. Hamilton and Dr. Kim.